the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.
Hey, good morning, everyone, and welcome to Euronurse. I'm your host, Vic Sinise. Glad to have you on board. Hope all of you survived those storms last night. It was crazy, and I saw it was affecting a lot of the U.S., so I'm sure some of you have had some storm stories yourself. Hey, if you're watching the show and you haven't had a chance to like and subscribe, always make sure you do. So today we got a great show for you. I'm going to be welcoming Dr. Joel Pash, a board-certified anesthesiologist and co-founder of Upsize Clinic, a leading practice specializing in safe, non-surgical male enhancement as a pain management expert and one of California's most experienced male enhancement specialists. Dr. Pash brings a unique medical perspective to an industry that is booming, but increasingly dangerous. Male enhancement is at an all-time high, but so are botched procedures and avoidable pain. Many men assume these treatments are safe, standardized, and painless, but the reality is that most clinics fail to prioritize patient comfort and long-term health. Dr. Pash will provide an essential guide into avoiding dangerous procedures. So let's welcome Dr. Pash to the show. Hey, welcome.
Thanks for having me. Good to meet you and looking forward to this.
Yeah, great. So I'm going to just turn it over to you for a little bit here. You're going to just talk a little bit about what you do and what's involved in all this, and then we'll get together for some questions and answers. Audience, if you have any questions, put them in the comments. We'll be glad to answer those. So go ahead, take it away.
Okay, so as you said, I'm a board certified anesthesiologist. I started Upsize about 4 years ago now, and we've done I've personally done 1,500 or so male enhancement procedures. I think if you combine all our doctors, we've probably done 4,000 or 5,000. So I thought what I would do today to start out is just go over the options that exist for male enhancement. Obviously, I lean towards the way I do it as the safest and what I think is the best, but I figure I'll cover all of them or all the common ones. And then at the end, I'll cover what we do. And then during the questions, we can, probably we'll focus mostly on the actual technique and version that Upsize does. So to get started, there's various options for male enhancement, ranging from stuff that works to stuff that doesn't work and stuff that's safe and isn't safe. The most common thing that you'll hear about or that people are usually looking for is pills, right? When we see people that are, for example, doing a Google search for penis enlargement or male enhancement, usually they're thinking about some sort of pill. As you guys probably know, none of them are really effective. At best, they're like some sort of hidden sildenafil or tadalafil in there. At worst, they're something that we don't know what it is, or maybe ephedrine or something like that. Anyways, they might give you a better erection, but they don't give you any, actual size increase. I think the second most common thing is pumps. We see a lot of people that use those. Those also have no long-term benefits. They do cause like a temporary increase in size due to vascular engorgement. The main issue is they don't really work, but something we see commonly is people that come in, we can tell if they've been using a pump because their penis is all discolored and almost like permanently bruised. So it looks like it's kind of beat up a little bit. And so I can kind of tell if someone's been using it. So it's like, it kind of ruins their penis with no long-term benefits. Kind of the last thing on the, in the category of stuff that doesn't work is extenders or traction devices. Now, though, to be clear, they kind of work a little bit in the sense that if you stretch something over time, you do get tissue remodeling. So it's similar to if you're, when you see people get reconstructive surgery and spacers put in when they have breast cancer and reconstruction, we'll put in spacers. It'll stretch out the skin so they can get breast implants. So a similar thing happening on the penis. You wear a traction device over time and it will stretch out the length. We're talking though about, maybe 3/4 of an inch or something and in length. And that happens over years, not over one visit or something, or, one session. And then the disadvantage is you just get kind of like a skinny, long penis. Anywhere from 45 minutes a day to several hours a day is what that takes. And so there are guys that are really motivated and they'll do it, but for most people, it's not practical. So now onto the actual medical procedures. The most common procedure I shouldn't say the most common procedure, but one of the oldest procedures is fat transfer. So they take fat out of some part of your body, usually abdomen, using liposuction, and they inject it into the penis in between buccal fascia and dartos fascia. As you can imagine, it basically looks like you have fat in your penis. So it does make it thicker, but from what I've seen, it's not, it doesn't look good or symmetrical. It can be lumpy, and your body does break down fat over time. So it's not permanent. And when your body does break it down, sometimes it doesn't break it down evenly. So you'll end up with lumps and whatnot. That and the other issue is it requires surgery and liposuction has its own risks. There's implants that people put in made of silicone or alloderm, which is like a biologic mesh. So those do give you some thickness. The silicone version is permanent. The biologic mesh is not permanent because your body can also break that down. The issue is that in order, like the penis shrinks and expands all the time. So if you put in a fixed size of a piece of silicone, you're obviously you don't want to put one in that's shorter than the penis. So they usually put one in that's the actual length of the penis or longer. And then as the penis shrinks and expands all day, it gets some like a friction point against the actual implant. And it's fairly common for them to erode through the skin. And then of course you get infections, you have to get it removed. And that can be quite devastating. I think those things have about a 5% rate of that happening. So that's obviously pretty high. The last surgery is the suspensory ligament release. So what they do is they cut the suspensory ligament of the penis. It allows it to hang lower because it's not connected to your pelvis anymore. The issue with that is, number one, when you have an erection, your erection points down. So that's awkward. It's mostly flaccid length that you get. And the ligament tends to reattach over time. But when it does so with scar tissue. And so actually it's almost has 100% chance of shortening your penis long term. So obviously that's not what people are looking for. So now onto the fillers. We can break that down to permanent fillers and temporary fillers. We do temporary fillers made of hyaluronic acid, which is the same filler that's made that women will use to put in their lips or their face typically. But let's talk about permanent fillers first, because we'll cover what I do last. So permanent fillers can be anywhere from silicone to PMMA, which is like plastic little particulate things, and they are like micro particles. The intent of these is to also inject in between dartos fascia and bucks fascia. And the theory is that your body has like a response to those fillers that causes collagen formation. And then it's thought that that collagen formation can be permanent. The issue though with permanent is that all the fillers, including the hyaluronic acid fillers, have some degree of revision necessary. And when you have like a permanent filler that has a subpar result, either you can sometimes correct it with filler, but you can't remove it without surgery. So we see a lot of people that get these fillers for whatever reason, it doesn't look good or they're not happy with it. And now they're getting their penis cut open to get this stuff removed. And then of course you get permanent issues like adhesions, which can make your penis shorter, and trauma to the nerves. So, a lot of time they have permanent erectile dysfunction after that. Now, lastly, the HA hyaluronic acid fillers, which is what we do, are kind of an ideal male enhancement technique. It's also injected in between bucks fascia and dartos fascia. It uses the way we do it, at least, uses a aesthetic microcannula. So it's not sharp. So it has a very low chance of traumatizing any structures that you don't want to traumatize, like veins, arteries, or nerves. The filler that we use lasts about an average of 2 years. It will cause thickness or girth, which is basically what all of the other things we just talked about does. And it'll also cause some flaccid length increase. It does that because the penis basically gets heavier and has this material in it that works like a scaffold kind of. So basically the length increase is due to the penis not shrinking as much because it shrinks and expands all day. So we tell people they can get about 3/4 of an inch of flaccid length increase, but no erect length increase. I always tell people getting erect length increase would be kind of like trying to increase the length of your arm, right? You would have to cut it off, graft in skin, blood vessels, nerves, arteries, veins, muscle, bone. So it's obviously impossible, but it is very easy to make your arm thicker just by putting fat in. If you gain weight, it'll get fat in it, or you could put any sort of material underneath the skin. There is some, so back to the fillers, there is some rate of correction necessary, but the filler can be easily dissolved with an enzyme. So if you have an asymmetry or a lump that you need dissolved, it's a quick injection with a 30 gauge needle. It dissolves immediately, and it can be revised by adding small boluses of filler in whatever areas need to be revised. So I think I'll end it there. I kind of covered every possible male enhancement option, including the one I do, which is the hyaluronic acid fillers.
All right, that's great. Now you were saying, we were talking earlier in the show, that you also have programs where people can learn how to inject this medication, I take it?
Yeah, so we have a company called Urosculpt, and Urosculpt is a training and certification company. So we've trained about 40 providers to date. So that would include physicians, nurse practitioners, and physician assistants. We train them. We have certification where they take an exam after training, and they're every 2 years there's a recertification requirement, as well as some QA requirement where we take a look at their before after images and make sure they haven't had complications and all that. The training that we do is in person, but we're in the process of releasing a online training. And that'll be online within about a month. So we, Upsize Clinic does patient-facing stuff. So we do procedures on patients, and Urosculpt is kind of a provider facing business.
All right, great. One of the things you had mentioned was the stretching devices, and just to kind of get away from a bit of confusion, because we've had Dr. Landon Trost on our show who does Peyronie's treatment, and they do use traction devices with Peyronie's to try to help correct that along with the injections that they do for that. So you're not against traction devices in general. It's just that using it for trying to add length, correct?
I'm not against them at all. Like I said, they do kind of work. As far as all the things I listed, it's besides for what we do, I think it's the best option. And I don't even discourage people from using it in addition to what we do, because it gives length. That obviously when you stretch something, it gets thinner. And so in a way, it's ideal to combine them both. And in fact, the main device that's used for Peyronie's is the RestoreX device, which is probably what your guest talked about. That has an FDA approval for restoring length in people that have had prostate surgeries. And I think that they just say for chronic disease. So for whatever reason, you get a shorter penis, maybe it's diabetes and vasculopathy or something like that. So it can increase length. So we assume that the FDA approved, you know how FDA approvals work, where it's usually for an isolated thing, but off label, these things usually work for a bunch of other things. So I assume that since it works for quote unquote chronic disease lengthening, it probably works for lengthening in non-chronic disease.
Yeah. And just for our folks that, maybe non-medical watching this, so just to reiterate, the hyaluronic acid is going to make the penis appear bigger when it's not erect, correct?
And when it's erect. So
okay.
So basically we're just putting them in length would be only flaccid, because basically the penis grows longer than where the filler, the filler is underneath the skin, so it grows longer. I should say it grows longer when you have an erection, right? So the filler itself can't make your penis longer than what the erect length is. And again, it's just like if you visualize putting something under the skin in your arm, you can make it thicker, but you can't really make it longer.
Yeah. Just wanted to make sure that confusion. One of the things that we talk about on our sex therapy is the perception of what's a normal sized penis. That most men don't understand what normal penises length are, or they kind of underestimate it or psychologically think that their penis isn't long enough. So do you have any criteria used to evaluate patients so that we're treating appropriately?
Well, we're not necessarily this is cosmetic, so we're not treating abnormal penises per se. Mm-hmm. First of all, by definition, almost everyone's normal, right? Except for some, the 0.1% at the end, right? Micropenis being that you had not proper hormonal development, but everyone else is normal, but normal can be 3 inches and normal can be 7 inches. So, and believe me, there's guys that are 7 inches that want it bigger, and there's guys that 3 inches that don't care. So, it is purely cosmetic. I think the average length is 4 inches flaccid, and about 4 inches thick flaccid, or within a half inch of that anyways. And I could tell you that most people think they have a small penis, and most people don't have a small penis, right? Most people have a normal size penis by definition.
So mostly cosmetically, if they feel that their penis isn't as big as it should be, you can use the filler to make it larger.
Yeah, or what it should be is kind of, it's not like the most common reason for someone to come in is just that they want it bigger. It's not even that they think it should be bigger, right? They just want it bigger. So it's like breast implants, right? You have what you have, and they're just fine.
Thinking it's similar to breast implants. It's ranges.
some people want a size D. You don't need a size D. You just
Yep.
want a size D.
Now, is it covered by insurance?
No, it's a fully cosmetic procedure.
Fully cosmetic. All right. I do have a question that came in. What specific protocols do you use at the Upsize Clinic to minimize pain, anxiety, and post-procedural complications? And maybe you can elaborate on what complications you see with using this. Are there any side effects or erosion of the material? Or
Yeah, so the only, like practically speaking, the only complication I've ever seen is infection, which is quite low. Like I could speak for myself. Out of doing, let's just call it 1,500 procedures, I've had 5 infections maybe. So that's probably equal to or better to than what you would expect with any kind of medical procedure. A medical procedure in general probably has 5% chance of infection or something. In all those cases, we just give antibiotics and it gets better. I've never had anything that hasn't gotten better with antibiotics. And of course, since it's dissolvable filler, the worst case scenario, you just dissolve all the filler. So whereas if you have an infected, non-dissolvable foreign body, that could be a problem, right? Because for an implant, you might have to actually surgically remove it.
right.
In terms of what we do to minimize those complications, well, first of all, we have pretty much a standardized protocol as to how to do the procedure. So everyone we teach, we kind of expect them to be doing it the same way, and that way has been done thousands of times now and has kind of proven to be safe. We use, as I mentioned before, aesthetic microcannula, which when injecting dermal filler is pretty much well established that it has a decreased risk of vascular occlusion, which is a risk of dermal filler, and has a decreased risk of traumatizing anything like nerves or blood vessels. Or, in this case, there's some theoretical possibility you could puncture the urethra or the corpus cavernosum, although you would have to be incredibly negligent and not know what you're doing to do that because they're not in the same area that we're injecting. But nonetheless, using something that's not sharp, substantially decreases the chance of that happening. In terms of comfort, there's a couple ways so the main thing of comfort is just numbing everything properly. Once you get everything numb, there's no pain. So
you do a local block?
I just do local. Yeah. There's some techniques where they'll do penile blocks, but all the penile block is done blind. The nerve's fairly deep and it doesn't work all the time. Just like any blind block doesn't work all the time, right? You go to the dentist and they do the block in your mouth, and like 2/3 of the time they have to redo it 3 times before they can do their work. So like a penile block's the same, but when you numb the skin directly, which is what we do, just basically a field block, just numbing the area where we're injecting, it's like 100% works perfectly 100% of the time. And then, the other thing is it has to be the right person doing the procedure. Patients tell me I'm good at talking to them, and, we, try to talk about sports or whatever it is, right? To take your mind off music, whatever it may be that, I feel like I could find something in common with everyone, and that's a good place to start. And I think all doctors
underestimate how strong of an anesthesia that is, just having a conversation. I think
totally
good,
right.
Good practitioners are great at it.
If you can talk to someone about something interesting, the procedure's 45 minutes. They always leave there saying that this was way easier and more straightforward than they thought. And as everyone that's a medical provider knows, if your patients like you have like a way higher satisfaction rate and a lower chance of getting sued and having complications and everything. So it's one of the most important things in medicine is just being easy to get along with and having people like you. In my case, having surgeons like me too, right? Because I'm an anesthesiologist. And so one thing I've learned over time is you go in the operating room and the first thing you say is, "Oh, you've got the best surgeon there is. Like everyone loves this guy. He's the number one urologist in Sacramento," or whatever it is, right? And then it's like whether or not that's true, the surgeon thinks you're amazing after that, right? And then you get a good rapport with them.
Yeah. I've done a lot of catheterizations, and the first thing I always tell patients, listen, I'm the expert. I've done this before. I'm the best there is. And it goes a long way. Now, hopefully it's true, but in my case it was, but it does make a difference if people have that faith in what you're doing.
Yeah, and if you're actually good, I mean that's important too, right? But
That helps
but
too.
any of us that have done thousands of things, you're good at it, right? So
Now, is the procedure one and done, time you come in, have the enhancement and you're finished, or is it something that typically has to be done over a course of time? Or
like the technique that I do or that the upsize or Eurosculpt providers do, it's usually 80% of the time it's one time. People that want a reasonable size increase, it's one time. Some people, by the way, the amount of girth increase that you can get is anywhere from a 1/4 inch in circumference up to like 2.5 inches in circumference. So, 2.5 inches in circumference, fairly, that's a very generous size increase. So sometimes if you need a lot of filler put in, it might be 2 visits, but typically it's one. There's some other techniques to do it where it'll be like 4 or 5 procedures. And so that's one of the advantages that we have over some other techniques.
all right. Another question here came in. What are the most common complications or botched outcomes you're seeing, and what usually causes them? So I'm sure other people are doing these enhancements.
Yeah, so like I said, it's pretty safe in general. Even if you go to someone that's technically not as good as hopefully what I am, it's very rare that you see like an actual complication per se. Like I said, maybe an infection, which can happen with anything. I've never seen or heard of or anything damage to the urethra or the corpus cavernosum or permanent nerve injury or anything. One thing though that is very common is migration of filler. So if it's not injected properly, it'll kind of immediately migrate to a place you don't want it to go right after it's injected. That's because the space in between Buck's fascia and Dartos fascia is kind of what we call a potential space, right? It's there's, as soon as you inject something in there, it opens up a space, and it's otherwise just like some fat and connective tissue and stuff. And so anything you inject in there can move around anywhere. That's basically just technique. But it's very common that when we see patients that had it injected elsewhere, they come in for us to fix it because it's all migrated somewhere. Again, not really a complication per se, because you can just dissolve it, but definitely not an ideal cosmetic outcome. And then going back to the permanent fillers, that's one of the reasons I don't like permanent fillers, because in those cases, it is a complication because it's just there unless you get surgery to remove it.
Right, right. And then there's been some risk of silicon leaking and leaching other areas if they're using silicon products and etc.
Yeah, silicone's horrible. So silicone is not meant to be a filler even. So at least with the PMMA and Sculptra and all that, those are actual dermal fillers. So it's like if you inject it in the skin, at least it's supposed to be in the skin. Silicone's not supposed to be in the skin. So they actually get lymphedema because it basically clogs up their lymphatics, and they get inflammation and granulomas and all kinds of stuff.
So what are your post-op instructions to the patients? What should they expect? How soon can they resume having sex, etc.?
Sex, we tell them to abstain from sex for 1 week. That's mostly just due to, or to prevent infection, not, you have some little scabs and little needle holes in your skin. So we just don't want to break those open. Other than that, there's not much post-op instructions. There's some chance that you would need to do some shaping or molding of the filler. So we'll show them, if you have a lump here, just like squeeze there and and move the filler back into place. But that's rare even. And basically go back to the gym the next day kind of thing. It's benign enough that people will come at their lunch break, and like my office is in San Francisco and we have all these tech guys and stuff. And it's like the guy works at Apple. He got out at lunch for 11 a.m. and went back to work at 1 p.m. or something. Like nothing happened.
Yeah. Much bruising. I know like Xiaflex, you see these huge black and blue penises from or Pyrones.
There'll be substantial bruising. Never had any, like I've literally never gotten a phone call saying I need pain medication or can you, give me Percocet or something like that. I don't even know if I can prescribe Percocet. I've never done it. At most I'll just tell people take Advil or something like that. But yeah, bruising and swelling, it is a medical procedure. So,
yep. All right, great. I think one more question here for you. So looking ahead, what innovations or standards do you think are urgently needed to make this field safer and more patient-centered?
So one of the big things that I notice is doctors or nurses or PAs or whoever can be unfortunately dishonest and have misleading marketing and advertising. I wish there was something I could do about it, but I can't, right? I'm not going to call the Federal Trade Commission and file a complaint on half of the male enhancement doctors in the United States. But there's all kinds of claims out there, like we'll add 3 inches onto the length of your penis, which is obviously ridiculous, or permanent, or even saying, because nothing's really permanent, right? Even silicone's not permanent. Or will, the suspensory ligament release almost has 100% chance of shortening your penis. Of course, that's not advertised. The silicone implants that there are, like the rigid silicone, have a very high rate of complications. And of course, on the websites of whoever's selling those, it doesn't say that, right? So that, I think that's the biggest issue that we have, is just not truthful advertising and people that are unethical and just want to make money. And personally, I don't know how you can sleep at night doing that. And I feel like you have a good chance of getting sued or actually just harming people. But for some reason, people can do that, or providers are comfortable doing that. And then there's, we briefly talked about at the beginning, we have Eurosculpt, which does certify practitioners. So right now, this isn't something you learn in residency or you learn in med school. And the only way to learn how to do it is to kind of watch someone else do it. But you can come get official training through us and be certified through us. So that people getting certified in something using a standardized technique, I think that has its benefits. And while that isn't perfect, because you can be board certified in medicine and be not good at what you do, at least that is that's some sort of safeguard that you've had.
At least you're educated and still don't know what to do, but at least you got certification. Right. Are there any big red flags that people, patients that are looking to get this done, that they should look for? They should look for certification, that, ask those kind of questions. Anything else they should know when they walk into an office, whether they think this is legit or not?
Yeah, obviously certification is a big one. We're hoping that we become the standard in certification, because there isn't one right now. Always, whether it's a penis procedure or a spine surgery or whatever, find out how many your doctor has done and what the outcomes are. Ask to see before after pictures. Is this their first procedure ever, or have they done 1,000 of them? And in fairness, anyone that learns how to do it has to do the first one at some point.
You have to have your
but-
first patient sometime, right?
So there's I'm a little cautious of saying that you should only see someone that's done 10,000, but if they have certification and they've done the right training, then, that I think that's good if it's something safe. And if you're a patient, don't be like shy about asking for a discount if the doctors said they've only done 10, right? Or you're the first one. Okay, well, it's a safe procedure, so you're not going to harm me. So how about you do it for 30% off or something like that? In cosmetics,
what the cost is for this procedure?
The cost ranges from about 4,000 to the sky's the limit kind of thing, but the prices are on the website, so it's honest pricing, and the average cost is about $7,000 for the procedure. And it's
not covered by insurance. That's out of pocket.
No, this is as it's like, look at it like breast implants or butt implants or facial fillers or Botox. People get their lips injected. It costs $800 and lasts for 6 months. So, and this lasts a lot longer. These things are just expensive, and part of it's a function of drugs being expensive in the United States. The filler we use is literally 5 times the price what it is in the United Kingdom, for example, and about 3 times the price of Canada. So there's that. And, unfortunately, you don't have as many. If you're a urologist, right, you're seeing 25 patients a day, right, in clinic, and we're seeing 5. So it's, you got to pay the bills somehow, right? So the prices have to be a little more expensive.
Yep. Well, it's been fascinating. I think this is a great discussion. Really enjoyed your time that you spent with us, Joel. I'm going to put a little promo out for next week's episode.
Discover the future of treating urge urinary incontinence with the innovative AltaViva system by Medtronic. An FDA-approved, minimally invasive implantable tibial neuromodulation device designed for long-term symptom relief. In this episode of Euronurse Vixenese and expert Dr. Keith Xavier break down everything healthcare professionals and patients need to know about this cutting-edge therapy. Join us on April 25th at 9 a.m. Central Time to learn more.
Yeah, so join us next week. We're going to be talking about that, and looking forward to that episode. Joel, it's been great. Any last words of advice you have for folks?
If you're a medical provider, this is a good way to supplement your income, and it's very rewarding in terms of patients love you, right? It's a big deal for them. We have interesting patients, and it's just a good way to expand your practice. If you're a patient that's a male patient, obviously, don't feel that this is weird or something that only certain type of people do. We have all kinds of patients, from your, elementary school teachers, pediatricians, dentists, lawyers, plumbers, like just anyone can come see us. It's just a interesting group of normal people. I will say also, if you're a provider, in terms of adding this to your practice, we have lots of doctors and nurse practitioners that have like regular non-cosmetic practices and just add this as a thing that they can do for cash pay in addition to what they are already doing.
Yeah. Oh, great. All right. Well, very good. Thanks everybody for showing up, and we'll see everybody next week on euronurse.com.
So